Okay. So again, good morning to everyone. My name is Kanita Sneed. I am the Healthcare Program Consultant at the Department of Community Health, and I am the one who administers the Hospital Presumptive Eligibility Program. So I am the contact person for this program. So if you have any questions or concerns or anything dealing with this program, I am the person that you will be in constant communication with. Before we get started with the training, we just want to go over some housekeeping rules so our training can go smoothly and that everybody is able to get all the information that they need. First, we want to say that I want to make sure that everybody keep themselves on mute because we don't want any type of distraction while we're going through the training. And we want to make sure that everybody is hearing everything that I am saying in this training. If for any reason you need to take yourself off mute to ask a question, or for me to clarify anything or repeat anything, you're more than welcome to do that at any time. And you're able to ask your questions throughout the training. You don't have to wait to the end. So you're able to ask any questions whenever you have questions. If you need me to slow down, because sometimes I do tend to go a little bit fast, please let me know. And I am more than welcome to do that or repeat anything that you need me to do. For lunch will be 30 minutes. We will try to shoot around 12:30. Depends on how far and along the training that we get. It is going to be a long training from 9:30 to 3:30, but it also depends on the pace of the class and how you all grasp the information. So it may be all the way up to 3:30, or you may get out before 3:30, but it just depends on the pace of the class and how fast we're going through the information because it is a lot of information. But I want to make sure that you understand everything that is being provided to you today, because after this, then you will start, taking PE determination. So I want to make sure that you understand everything that is being presented today. So those are the kind of housekeeping rules. Do I have any questions before we get started? And this is also a training that I'm going to have you all to participate. I'm not going to be the only one talking. So I will be calling on individuals to participate in the training. So I want everybody to be mindful of that. This is a participation training that we're going to all be here to help each other, to ask questions, and just to participate to make the flow of the training go a little bit easier. Do I have any questions before we get started?
I do have a question. When wanting to ask questions, do you want us to raise our hand? I hate to interrupt you, but
Yeah, you can do
we
that
can do
because I
raise.
have two screens, so I'm able to monitor if your hand is raised. That's fine.
Okay, okay, thank you.
Thank you for that. Are there any other questions? And everybody can see my screen, correct? The
Yes,
PowerPoint? Okay.
yes.
Yes.
All right. So we'll go ahead and get started. Like I said, this is the training for the Hospital Presumptive Eligibility Program. So what you all are going to be doing, individuals that are eligible for Medicaid, they can come through you all to apply for Medicaid without having to go to DFAC. So this is the reason for this training. And we're going to go ahead and get started. So again, my name is Kanita Sneed. And so at the Department of Community Health, we have a mission, and our mission is that we try to provide access to affordable quality health care to Georgians. And we're going to do that through effective planning, purchasing, and oversight. And the purpose at the department is that we're shaping the future of a healthy Georgia by improving access and ensuring quality to strengthen the communities that we serve. This training is going to go over all the policies and procedures that you would need in order to do this program correctly. So, in order to make a determination, a Medicaid determination from somebody, you're going to get all the policies and procedure that you would need. Nothing is going to be left out. So don't feel like, oh, she didn't tell me that in the training. Everything that you need will be given to you today. If you pay attention, write notes, ask questions, you will not have a problem. But everything that you need to make a correct P determination will be given to you today. So, here are some objectives for each participant today. You're going to understand the definition and description of hospital presumptive eligibility. That is what HPE stands for, hospital presumptive eligibility. Understand the requirements and the responsibility as a provider participating in this program. So, as a qualified hospital participating in this program, there are certain requirements and responsibilities that you need to understand. And for this program, for members that are applying for these programs, of course, they have to meet certain requirements. So the requirements we're going to look at is the program requirements, eligibility requirements, and procedural requirements. That means entering the information into the GAMET system. And we're going to look at with Medicaid, there are 8 categories that a person has to be approved for. So with this program, there are certain 8 categories that you're going to make determinations for, and we're going to look at those particular 8 categories. Understand how to enter this information online. So everything is really going to be done on paper first, like the application, the approval, giving them the information that they need. Everything is going to be done on paper first. And then once you made the determination if the individual is eligible, then what you have to do is to enter the information that is on that application. You're going to have to enter it into the GAMET system because that will tell us that this person has been approved for Medicaid. Therefore, they're able to go and get the medical services that they need or either get their prescriptions filled. So that's how their coverage or their claims or anything going to be paid because you're able to put the information in GAMS. And there are certain performance standards for each qualified hospital. We will go over that. Look at the references that you're going to use. And for everybody that's here, you are a new employee coming into this program. So you will have to take an assessment after this training. And the assessment is not hard at all. If you pay attention to the examples and pay attention to what I'm saying, mostly all the answers are in here. They may not be verbatim word for word, but they're going to be similar examples that we go through in this training. It's going to be the same examples that I give you on the assessment. So that's why I say if you pay attention, you will have no problems in passing the assessment. And you will have to pass the assessment with a 80% or higher and fill out some other paperwork before I approve you to start making PE determinations. But we'll talk about that towards the end of the training. All right, so let's get into it. So the first thing we're going to do is define by law what hospital PE is. So presumptive eligibility has been around for a minute, and that is for pregnant women. So if you were pregnant and you needed Medicaid, you could go to the health department and apply for Medicaid. Well, since the Affordable Care Act became into law when President Obama signed it, he now allowed hospitals to start making presumptive eligibility determinations. And so that's why we have this program now, and that's why you're participating in this program. So, as a qualified hospital has to be one that is already participating as a Georgia Medicaid provider. And you notified us that you wanted to participate in this program. So, that's why you're in this training today. You're going to agree to make PE determinations according to the policies and procedures that you're going to receive today. Also, with an individual is applying for presumptive eligibility because let me make one distinction. Presumptive eligibility is Medicaid. They're just applying for Medicaid, but we just call it presumptive eligibility. And the reason why it's called presumptive eligibility is because it's only temporary. It is not, they don't have that type of coverage for a full year like they would if they went through DFACS. So presumptive eligibility is temporary Medicaid. It's only going to last for a certain period of time. But since they are applying for presumptive eligibility with you all, They also will have the option to apply for full Medicaid. And we're going to talk about how you all will assist them in applying for full Medicaid. And that's going to be through the paperwork that I said that you have to do. And they're going to be filling out really another application that will be sent over to DFACS for them to process that full application. But we will talk about all of that. And then a qualified hospital is one that has not been disqualified by DCH. So, what is presumptive eligibility? It is an expedited way of how we enrolled people that are eligible for Medicaid, how we get them enrolled in the Medicaid program. So that's why they're starting with you. They don't necessarily have to go through DFACS all the time. If they meet certain requirements, then that's why they can come to you all. And then, if of course, if they're pregnant, they can go through the health department. So we're just trying to give them another avenue to be enrolled into Medicaid without just having to go through DFACS. For presumptive eligibility, this is what you're going to base their eligibility on. These are some of the requirements that they have to meet before they are approved for presumptive eligibility. We're going to look at their income, and their income is going to be Magi-based income. And Magi-based income is just income that is taxable. There is some Magi-based income that is not taxable, like Social Security, tax interest, foreign income, things of that nature. But their income still is going to be based on Magi. And Magi just stands for Modified Adjusted Gross Income. And we're going to look at tax filer status, meaning we're going to be asking them, every applicant that comes in, there is a specific question that you have to ask them, because asking them about their tax filer status will also determine what we call a budget group, determining who should be included on their budget group. And then once we determine how many people are in their budget group, that determines the income limit that we're going to compare their income to. Because, of course, with income, they have to meet the income limit. There are certain income limits that we have for Medicaid that a person has to meet. They have to be at or below that amount. We're going to look at the household size, citizenship, immigration status, meaning they have to either be a U.S. citizen, national, or what we consider a qualified immigrant. And we will talk about how you all would determine if someone is actually a qualified immigrant. And then also they have to be a resident of Georgia. So the first thing we're going to talk about, and this will be on your assessment, is called the PE period. So this is basically just saying how long they would get this coverage if they are approved. When does it start and when does it end? So this is called the PE period. So the PE period always starts on the date that they apply and get approved by you. And then it ends the next month at the end of the month. So an example, I gave you two examples at the bottom. If you have someone that applied on January the 6th, 2022 and was approved, their PE period, when it asks for PE period, you're going to put down 1/6/2020 through 2/28/2022. So it starts on the date that they apply and get approved with you, and then it ends the next month, and it always ends at the end of the month. So we don't stop the coverage in the beginning of the month unless, DFACS makes an eligibility determination for their full Medicaid, but it's still, that's something on the back end that you really don't need to know. So the only thing that you need to know is the start date and the end date. Another example, if someone applied and was approved on 11/30/22, then the PE period is going to be 11/30/22 through 12/31/22. So it starts on the application date, ends at the next month at the end of the month. So when you see that question on the assessment, please make sure you give the date range, because I have a lot of people that either get it wrong or get half credit because they are only giving me one date. They are either giving me the application date or they're giving me just the end date. But you for it to be a PE period. That's why it's called PE period. You have to give the date range. Any questions so far before we get into the next part of the training, where we're talking about your requirements and responsibilities? Okay, I'm going to take silence as a no. So, as a qualified hospital participating in these programs, these are your requirements and responsibilities. Notify DCH of your interest in this program, which has already been done. Sign an MOU. You all don't have to worry about that because your actual hospital is already participating. So that's already completed. Sign a qualified hospital provider agreement and statement of completion training form. So everybody should have printed off everything that I sent you in the training material email. Did everybody print everything off?
Yes, I did.
Thank you. Okay. So in that material that you receive, you should have a sheet or a form called a qualified hospital provider agreement. And then you also should have a form called the statement of completion training form. Does everybody have that in front of them?
Yes, I do.
Only heard one yes.
I'm checking. One moment.
Okay.
Yes.
Thank you. I heard two yeses. Remember, everybody has to participate.
Yes, I have it.
Okay. I have three, four.
Yes.
Thank you. Okay. I have one looking for hers. If your mic is not working, there is a phone number in the invite. If you all can dial in while you're on Teams, you can dial in via phone, and you should be able to use your phone as a mic. Okay. So the first one is the provider agreement. Those are things that you have to make sure that you are adhering to. So you just read all of those statements, making sure that you agree to those and sign it. And make sure, I think it asks for your like hospital name at the top. Please make sure you're entering your hospital name and sign it. The statement of completion training form is just telling you that, you went through training, and then this is a list of training materials that you should have received. I need you to complete that form in its entirety, making sure you initial beside each training materials that you receive. And then at the bottom, you're going to sign again and date it, print, sign, and date. And then also you're going to get your PE coordinator to sign, print, and date. So please don't send me that form back if your coordinator has not signed off on it. Both of you all have to sign off on it, okay? I want to make sure that is clear because a lot of times in my training, when I get the material back, that is one of the things that is missing. Either the PE coordinator name signature is missing, or either they don't initial beside all the training material they receive. So please make sure you're completing these forms in its entirety so we don't have to do the back and forth. The next one is make correct PE determinations. That's why you're going to be receiving everything that you need today so you can make correct PE determinations. The last one, you don't have to worry about that. That is for PE coordinators to make sure they maintain a list of who's all at their hospital making PE determinations. Complete PE training and additional training if needed. So this is your first initial training that you have. And the only other training that we really have for this program, maybe like a refresher training for every year that is mandatory for everybody every year. So the next time you come to training will probably be sometime next year. And it's going to be just like this. And it's not going to be this long. It won't be an all-day training. Sometimes it'd be like a couple of hours or half a day. It's just going over things that I feel like what I kind of do is kind of look at the applications from the previous year to see where people are making the most mistakes and what I need to either expand on or, just to get more clarification on. So it is more of a refresher for you all, and also for you all to ask any questions that you may have that you have not asked already. So that is the only other training that we really have, unless, of course, you're the one that's not really making correct P determinations, and I brought it to your attention, you're still not able to do it. But hopefully we won't have that issue, because like I said, if you pay attention to everything that is being presented today, you should not have any issues. Cooperate with P monitoring and quality control, which is part of the performance standards. So towards the end of this training, you will be finding out about this. Your applications will be audited for this program, meaning that we're going to look at your application to make sure that you're completing everything correctly and making sure that you are sending these applications back to us timely, just taking all of that into consideration. So that's part of the performance standards. Develop a corrective action plan. That's only if needed, if a particular hospital is not doing what they're supposed to do. And then the last one is cannot delegate the authority to determine presumptive eligibility to another entity. So that's just saying from the federal law, from the federal regulation, that the contract that the hospital sign is between the hospital and the Department of Community Health. So that means the employees that work up under the hospital and not working for the third party company that your hospital may contract out with. So if you are a person that is not an actual hospital employee, you will not be able to make these PE determinations. It has to be done by the person that is actually paid and worked up under the hospital. So it cannot be you working up under a third party company in the hospital. You have to actually be paid and work up under the actual hospital. So that is what that regulation is about. So how can someone be disqualified as a hospital? It's not individually, it's as a hospital, and stop doing presumptive eligibility is that they're making or not capable of making P determination in accordance to the policies and procedures that DCH has set in place, and you're not meeting our standards. And then after we brought this to your attention and you're still not able to make the P determinations correctly, and we've given you additional training and taken other reasonable corrective action measures, then that's how you would be disqualified. But this has not been an issue since we've had this program in place. Okay, so now we're going to talk about the requirements. So we're going to get into how can someone be eligible for presumptive. And so the first thing we're going to look at is the A categories that you're going to make a determination for. So basically, when a person applies, you're going to be doing kind of like an interview with them to get all the required questions answered, to get, their situation, to actually see what A category they're going to be eligible for. Also, we're going to look at the time period. So how often, once they have been approved or denied, how often can they reapply for presumptive? We're going to look at how to enter the information in the GAMIT system once you have determined that they are eligible. And then also we're going to look at the application and all other forms that you're going to be completing for this program. So here are the 4A categories that you're going to make a determination to see if a member fits one of these A categories. And so we're going to look at these individually. The first one is called parent caretaker with children under the age of 19. And if you worked with Medicaid before or with the Medicaid program, this A category used to be called low income Medicaid. So that's what it basically is, low income Medicaid. But because of the Affordable Care Act came into place, the name has changed from low income Medicaid to parent caretaker with children under the age of 19. So this is kind of really self-explanatory. So it has to be a parent or a caretaker, meaning a legal guardian, whoever has guardianship over them or, take care of them. They have to be the parent or caretaker along with the children, and the children have to be under the age of 19 to be eligible for this aid category. So we're going to look at that tax filer status. Remember, I told you earlier that one of the requirements is their tax filer status. So we're going to be asking them one specific question if they expect to file taxes or not. And then that would determine if they're considered a tax filer household or a non-tax filer household. And it also determines who is going to be in their budget group. There are some exceptions that we're going to look at if they're considered a tax dependent. Of course, they have to meet the income limit, meaning once we calculate what their income is on a monthly basis, we're going to compare that amount to the amount that is on your income limit chart that you should have received, and to see if they meet that requirement. Of course, they have to be a resident of Georgia, meaning that they intend to stay and live in Georgia. There's no time frame or restrictions on how long they have to be in Georgia. So you can have someone that just moved today and they come in and apply. As long as they state that they intend to live and stay in Georgia, they're considered a Georgia resident. And then they have to meet the citizenship immigration status. So again, to be eligible for parent caretaker with children under the age of 19, has to be a parent or a caretaker with the children, and the children have to be under the age of 19. The second aid category is called children under the age of 19. So again, if you're, familiarized with Medicaid, this used to be called right from the start child or children right from the start. So again, this is children under the age of 19. So this is only for children under the age of 19 for this particular aid category. And the eligibility criteria is still the same as the parent or caretaker. We're looking at the tax filer, non-tax filer status. There may be some exception if they are a tax dependent. Income limit has to be at or below the limit, have to be a Georgia resident, and also have to meet the citizenship immigration status. Your next aid category is pregnant women. Self-explanatory, has to be a woman that is currently pregnant. She can't be in a postpartum period, meaning that she had the baby, but she's in her postpartum period. The person has to actually be pregnant. So again, the eligibility criteria is the same as the other two that we just went over, except the only thing is that they have to be pregnant, and we don't have to verify this. So they don't have to provide proof of their pregnancy. We're going to be taking their statements, and you're going to see this later on, what type of verification we're going to need for all of this. So for pregnancy, you're going to be taking their statement. If they say, you just ask them, are you pregnant? You say yes or no. So if she's pregnant, that's what you have to go by. And we understand some people are not going to be honest. We're not here to decipher if they're being honest or not. You all just have to take their statement and roll with it. And for the pregnant woman, she can only be approved for presumptive once per pregnancy. So if you approve a pregnant woman today, and let's say something happened, she may have a miscarriage or something like that, and let's say 2 months later, she's pregnant again. Well, she can come back and reapply because this is a new pregnancy that you're going to be making a determination for. But if it was the same pregnancy, then she can only be approved once per pregnancy. So we'll talk about that later on. So it's once per pregnancy. And then your last aid category is your former foster care aid category. So this is for individuals that were in foster care, but they aged out of foster care. So, with foster care, it goes up to a certain age, like 18. In some states, maybe higher than that. But I know in Georgia, it's 18. Once you become 18, you're no longer in foster care. So if an individual was in foster care and they aged out of the system at the age of 18 or older, then they may be eligible for this aid category. And here are the eligibility criteria for this aid category. They have to be a Georgia resident. They have to meet the citizenship immigration status. And they don't just have to been in foster care in the state of Georgia. They could have been in foster care in any state. So it's not only limited to them being in foster care in Georgia, it could be from any state. They have not reached their 26th birthday, meaning they have not reached 26 years of age yet. And with them, they're not, if you look at your income limit chart, there is no column for former foster care. So therefore, we're not going to be looking at any income for them. And also with that, we're not going to even look at or ask them about tax filer status as well. So that's the only difference with the former foster care, is that we don't look at any income for them. So their income is always going to be zero for them. And then we don't look at, well, their income is not going to be zero. We just don't compare it to the income limit chart. We have to ask about their income, and we'll put their income down, but we don't compare it to the income limit. And then, of course, we don't look at tax filer status with them. So those are your 4A categories. You have your parent caretaker with children under the age of 19. You have your children under the age of 19. You have your pregnant women, and you have your former foster care. Any questions over either one of those 4A categories?
No.
Thank you. Okay, the next one is, how often can someone apply for this program? So if it's a pregnant woman, I told you it's once per pregnancy. So if she's coming back in, try to apply, and she's already been approved for, you have to make sure that this is a brand new pregnancy. It can't be the same pregnancy. It has to be a brand new pregnancy. For your other aid categories, your parent caretaker, your children under the age of 19, and your former foster care, it's once every 2 years if they have already been approved. If they applied before and the application was denied, they do not have to wait those 2 years. They can come back at any time. As long as their circumstances changes, they can come back at any time and reapply. But if they were approved, they have to wait at least 2 years from the time that they were approved to come back and reapply for presumptive. That's why it's so important and highly recommended for them to apply for full Medicaid while they are applying for presumptive. That way, that they know their coverage, if they are approved through defects, they will at least have coverage up to a year until it's time for them to renew their coverage with defects. So it's highly recommended. We can't force them except for the pregnant woman. They're going to be required to apply for full Medicaid. They don't get an option. But if someone is approved for the other aid categories, we're going to ask them that question. We're going to give them the option, and then it's going to be left up to them if they want to apply for full Medicaid or not. Okay, I don't know if you all have these individuals that come into your hospital. And another thing I want to say is that people that are applying for presumptive at your hospital is not limited to just patients. So, of course, you want to capture those people that are coming in for services in your hospital, but just know it's not limited only to patients. It can be anybody that comes in off of the street. So if they know that you are, accepting applications for Medicaid, then they can come in and say, hey, I want to apply for presumptive, and they have that right to apply, and you cannot refuse them. So it's not only limited to your patients, it's anybody that wants to come in and apply for presumptive. So if there are individuals that are right now still incarcerated, they are not eligible for this program. So you just let them know, hey, since you're still incarcerated right now, you're not eligible to apply. You're not eligible for this program. So you need to come back and apply once you have been released. That's all you can say. So you won't do a PE application on them. You won't do the PE process. Just know that they're not eligible until after they have been released. So now we're going to talk about coverage. What does presumptive pay for? And as I stated at the beginning, presumptive is just like it's Medicaid. There's no, just because they're in presumptive, which is called, is just temporary Medicaid, is still Medicaid. So whatever Medicaid pays for, that's what they're going to get paid. So it's not like there's some restriction on it. On the pregnant women, there is a certain restrictions on that, but as far as everything else, it's going to pay. Like for instance, if they get approved for parent caretaker, if they have to be an inpatient, it pays for inpatient. But for pregnant women, it's only going to pay for their prenatal services and pharmacy prescriptions. It's not going to pay for labor and delivery. So that's why they have to apply for full Medicaid because we want their coverage to continue on. So that's why they have to apply for full Medicaid because I know sometimes you might get a member that's pregnant maybe 7, 8 months into her pregnancy and she can deliver any day, you know. So that's why they have to apply for full Medicaid because we want their coverage to continue on. So again, PE covers everything full Medicaid is going to pay for, except for the pregnant women. Pregnant women A category, it only covers prenatal care and pharmacy services. For pharmacy services, so once a person is approved for presumptive, they are able to go and go see a doctor, or either if they're a patient at your hospital, you are able to bill those claims. The only thing that's not automatic that day that they can get done is pharmacies. So, and the reason for that is because our pharmacy information or our pharmacy vendor handles all of our pharmacy claims. So therefore, when you input the information in our gamma system, that information then has to be translated or transpired to our pharmacy vendor, which is optimal. So that information has to go from the gamma system over to their system. So that takes at least 24 to 48 hours for that transaction to go through. So in that case, I want you all to get in the habit of telling your individuals that get approved, let them know, okay, you have been approved, but you're not going to be able to go and get any prescriptions filled today. You're going to have to wait at least 24 to 48 hours to get any prescriptions filled. That's what you would tell them once they have been approved. Now, if they come back to you and say, well, is there anything that you can do because it's an emergency? I really need my prescriptions. I really need to get this medicine today. I really need to take. Is there anything that you can do? In those situations, in emergency situations only, what you can do is to send an email to us at DCH, and the email address is listed here, the PE corrections at dch.ga.gov. You're going to send an email to that email address. And so you're just going to put, like in the subject, you can put like pharmacy updates or something like to that nature. Just let us know that it's something dealing with the pharmacy. And in the body of the email, I need you to give us the member's name, first and last name, and then the ID number that you see in GAMS. So give us that information and we have access to the Optima system. So we will go into the system and update it. And then we'll let you know, hey, information has been updated. They're able to go and get any prescriptions filled at that moment. But otherwise, they need to wait at least 24 to 48 hours before they try to get any prescriptions filled. Okay, so for pregnant women, they have an extra benefit, which is dental services. But in order for them to get the dental services, they are going to have to fill out or have their doctor to fill out a form to verify that, they're up under the care of a doctor before they're able to get those prescriptions, to get the dental services that they need. So the only thing you all have to do is to provide them with this DMA 635 form, and it's called attestation of pregnancy. So you're just providing them the form and tell them to take that form to their doctor to have them to complete it. Once their doctor completes it, then they would take that form to their dentist so their dentist can provide them with the services that they can get that is provided, that is paid by Medicaid. But they have to have this completed form before they're able to get any dental services. And then once they have their baby or either their pregnancy terminates, the dental services is going to stop. Y'all, please stop me if you have any questions or anything. If not, I'm going to just keep going until someone asks questions. So the first thing you will need to do before you start the presumptive process, and this is done on everybody that is applying, you're going to have to first do what we call an eligibility check or either screen in gamuts. You're going to check them in the system first to see what, if they are already on Medicaid, if so, what aid categories, and to also see if they are active or inactive. We're just trying to see to make sure that they're not already on Medicaid already, because if they are, then that'll tell you that you don't need to complete the process. So that's the very first thing you need to do. You may have people that come in and say, well, I've already applied through DFACS online. I just haven't heard anything. You're going to hear that a lot of times, but I'm telling you, don't go by that. Go by what Gamut shows you. So if they tell you that, you just go ahead and still pull them up in Gamut to see what Gamut shows you, because it doesn't matter if they've already put in an application with DFAS, because you can't see that side. You don't know if DFAS received their application or what their status is on that application. So you're doing a presumptive part, so you just have to go by what Gamut shows you. So if Gamut shows that they are not active, then you can go ahead and complete the PE process. So again, that's the very first step that you need to do. If a person is active, if it shows you that the person is active on full Medicaid, and I'm going to skip over to a couple of slides, and then we'll come back to this slide. So if a person is already on full Medicaid, once you put like whatever search criteria you're going to put in, whether you're going to put in their name, date of birth, their social, or if they already have their ID number, if they've had Medicaid before in Georgia, they have their ID number. You can search by any of those criteria. Once you put that information in and click search, it's going to pull up that person. If they were ever known to the system, it's going to pull up the last information we had or had on them, and it'll tell you whether they're active or inactive. If it says active, then it'll tell you over to the side, and we're going to look at some screenshots of Gamut, so don't worry about it. If it says active, then it'll tell you the AIDS category that they're active on. So depending on the aid category that they're active on, I'm going to tell you whether you can do a P application on these particular individuals or not. So if you look on slide 25, this is a list of the full aid categories that you're going to be looking for. So if it shows you active, you're going to look up under the A category column to see if it shows one of these A categories that is listed. So for instance, if it shows you 104, limb parent caretaker adult, that means that that person is already active on full Medicaid. So if they are trying to apply with you, they're not going to be able to apply because they're already active on Medicaid. So therefore, you just let them know if you have some changes that you need to report because you're already active, you're not eligible for presumptive, you've already active on Medicaid. So if you have some changes that you need to report, then you need to report them to DFACS, and they can go online at this web address, or either they can call the 1-877 number to report their changes, because they know when they get approved, they're supposed to report all changes within 10 days anyway. So again, if they're active on one of these aid categories, don't worry about the one highlighted in yellow or either turquoise. We're going to talk about those two in just a moment. But the ones that are not highlighted on this list, they're considered full Medicaid. So if a person shows active on this type of Medicaid, then you do not complete the presumptive process. Let them know. If they need to report any changes, they need to report it to DFACS. Okay, let's go back. If the person is active and it shows that they're on P4HB, P4HB stands for Planning for Healthy Babies. Again, P4HB stands for Planning for Healthy Babies. There are 4A categories for Planning for Healthy Babies, but the main two that you're going to be looking for is 180, which is the inter-pregnancy care, and the 181, which is family planning. The other two A categories that are not listed here, they're going to be listed with the P4HBA category along with another A category, which is parent caretaker or either ABD or SSI. So those individuals that are on P4HB, the 182 or 183 that is not listed, they have full Medicaid because you're going to see the 182, the P4HB 182, and you should also see either parent caretaker or either SSI or ABD with it. So that'll tell you that this person is already on full Medicaid. So again, these individuals need to report any changes to defects. But if a person is on 180 or 181, they do not have full Medicaid. Even though it's Medicaid, it's not full Medicaid. It's just really certain services that they receive. So in that case, these individuals are eligible to apply for presumptive. And I want you all to know this because you're going to see this, especially if a woman is coming in that's pregnant. These are most of the women or most of the population that are going to be on Planning for Healthy Babies, the ones that are coming in that is applying for a pregnancy. Yeah, you may have some that is applying for another A category, but truly, if they are pregnant, then 9 times out of 10, they're going to be on P4HB. So you need to know what procedure to follow. So in that instance, you're going to take a PE application on them to go through the process to make an eligibility determination to see if that person is going to be eligible or not. And we're going to talk about the whole process of how it starts from the time you do the interview all the way down till you make a decision if they're eligible or not. Then remember, I told you if you approve them, you're saying, okay, they met all of these criteria, they are going to be eligible. So if they are, then you have to add that to GAMIS. A lot of times we get, and we're going to talk about this P manual update form. When we get this form, when we go into GAMIS and we look and see that they're on Planning for Healthy Babies, a lot of times people skip this step right here, adding it to GAMIS. You have to add the PE to GAMIS first because we're not going to terminate this right here until the PE has been added if they are eligible. So please remember, if you did approve them, make sure you put the PE in GAMIS or making sure that you put their eligibility into GAMIS, taking the information from the presumptive application and just putting it into GAMIS. And then the only other thing that you would need to do is we're going to talk about a process called PE manual update. So PE manual update is something that you all can't do. There's something in the system that needs to be updated, but you all can't do it. So therefore, you're going to have to fill out some information and send it to us, and we're going to have to go in on our side to manually update it. So that is what the PE manual update form is for. So in this instance, the PE manual update is required because, again, these people, if they're trying to apply for something else or they get approved for presumptive, then this case right here, this Planning for Healthy Babies case needs to be closed. And so you all can't close it. That's why you have to fill out an update form to notify us that the P4HB case needs to be closed. And we're going to talk about the steps of that later on. But are there any questions so far of anything that we went over?
Yes.
Okay.
I have a question about the A category 182 and 183. I think I may have missed what you said we should do in that case.
So the 182 and 183, the reason why I didn't list them here is because they're actually going to be on full Medicaid. Along with having Planning for Healthy Babies 182 or 183, you will also see they're going to be either on the parent caretaker aid category along with P4HB, or either they're going to be on an ABD or SSIA category along with the P4HB. So that means that they're on full Medicaid. So you're going to refer them just like the other people that are on full Medicaid. You're going to refer them to DFACS if they're trying to report any type of changes or anything. So they're not going to be eligible to apply for presumptive.
Thank you.
You're welcome. Are there any other questions? Okay. So now we're going to talk about pregnant individuals that are active on medical assistance. So if you have an individual that is pregnant, and when you go and do an eligibility check or either screen that person in GAMIS, then depending on the A category that they're active on, these are the procedures that you need to follow. So remember on that A category list that we just went over on, I think it was slide 25. So the ones that are highlighted, I think it was turquoise. Let me go back. I think it is. No, it was yellow. So yellow, the one highlighted in yellow is women's health, and the one highlighted in turquoise is SSI. So if they're active on a women's health aid category, which is going to see probably 245. So if they're active on women's health and they're pregnant, then they need to report their pregnancy to DFACS so they can either report it to their caseworker. And how they would know their caseworker is they should have already received some type of communication or correspondence from DFACS. And if they have, then on that letter, their caseworker name and contact information should already be on there so they can contact their caseworker about that. Or they can go online, because once you have been approved for DFACS or whatever, or either if you apply online, you have to create an account. So once you create an account, you're able to go back and either look at the status of your application, report any type of changes, do any of that, submit any type of documentation. You can do any of that. So they can either go online and report a change, or you all can send an email to DFACS at the women's health at dhs.ga.gov. And if you do that, you're just saying, hey, this member came in to apply for presumptive. She's pregnant, but she's also active on women's health. Can you reach out to her? And just give them the person's name and phone number, and they can reach out to the individual. So that is for people that are pregnant and active on women's health. If the individual is pregnant and is active on SSI, that would be your 300A categories. So what you're going to do is to fill out this form on slide 23. You're going to fill out this form with the member's information up here, giving us the name, the ID number and GAMIS, their social security number, number of weeks they're pregnant, the due date, and then the number they're expecting. And then your information goes down here at the bottom. Once this form has been completed, you're going to email it to the PE Corrections email address that is listed here. And then what we're going to do is the person will not get switched. Your Medicaid is not going to switch from SSI to pregnant woman. What we're going to do is to go into the system and add their pregnancy information. They will continue to receive SSI Medicaid. So it's going to be up to them to talk to their doctor to make sure their doctor accepts their SSI Medicaid, which is fee for service. They are not enrolled into a CMO. It's going to be fee for service, which meaning all claims will have to be billed straight to Medicaid. So it's up to them to talk to their doctor to make sure their doctor is going to accept their type of Medicaid. Because at the department, we cannot require these providers to take these individuals. Is up to the provider. We can try to highly recommend them so they won't have to try to, search for all these doctors, but we cannot make them take these individuals. But they have to make sure that they coordinate with their doctor to make sure their doctor takes SSI Medicaid. The next one is if an individual is pregnant and on, these are our what we call Q-track cases. This is part of ABD. So there's QMB or SLMB. you don't really need to know what it means. So if it just shows you they're on QMB or SLMB, then these individuals, you're going to treat them like they have the P4HV 180 and 181, because for QMB and SLMB, the only thing they're getting paid is their Medicare premium. So they don't really have Medicaid services. We're only paying their premium. So therefore, they don't have full Medicaid. So you're going to, again, do a PE application on them and complete the process as normal. And then once you send their PE packet, we're going to talk about you sending PE packets to us. Once you send their PE packet in the body of the email, we just ask that you say, hey, this individual is active on Q-Track also. And then the last one is the QI1, is also an ABD class of assistance. These individuals, unlike the QMB and SLMB, they cannot apply for presumptive because they cannot be active on both A categories at the same time. But with QMB and SLMB, they can be active on presumptive and one of these A categories. But for QI1, they cannot. So the only thing you're going to do for them is to have them complete the full Medicaid application, not the presumptive application, just the full Medicaid application. You're going to look at it, what it looks like in just a moment. So once they complete the full Medicaid application, again, you're going to email it to us. In the subject line, this is what you put, QI1/pregnant applicant. And then what we would do is we would send it directly to DFACS and they will process that application. So again, women's health, these individuals need to report it to DFACS, or either you can send an email to the women's health email address. SSI, you need to fill out the SSI pregnant woman update form and email it to us. QMB or SLMB, you still do the process, the PE process as normal, and send the packet to us along within the body of the email indicating that this individual is active on Q-Track. For QI1, you only having them to complete the 94A. You email it to us with this subject line. Any questions?
Yeah, yes, I have a question.
Okay.
I got a little bit lost on the QI. Okay, here. So can you give me an example of like the QI1? Is this, I'm running it in gammas and this is the category that comes up?
Yes.
Okay.
So these are the A categories that you will see, and we're going to look at a screenshot towards the end of where you're going to see that at. So it'll say like status, it'll say active or inactive. And then over here, it'll say A category, and it's going to tell you these particular A categories. So that's what you're going to be looking for.
Okay, I understand. Thank you.
Okay, you're welcome. Any other questions? And then the next one is inmate Medicaid. So these are individuals that are incarcerated. And so when they're incarcerated, they can receive Medicaid, but they have to have been an inpatient in the hospital. So there are certain individuals that are incarcerated that can receive Medicaid. And so if they are, they may be on inmate Medicaid. But again, in order for them to apply for presumptive, they had to have been released. So if you have someone that comes in and apply, and once you go into GAMIS to look up their status, if it shows inmate Medicaid, then you're going to have to ask them, I see that you're on inmate Medicaid. Have you been released from your incarceration? If they say yes, then you're going to complete the process as normal. But the only thing you're not going to do is if you approve them, if you consider them eligible, you're not going to add it to GAMIS, because what I have to do first, we have to verify to make sure the release date that they gave you, we have to make sure that that is correct. So we have to make sure and verify that they actually have been released. So once you do all of the paperwork, if they are eligible, then you're going to send us the PE application. Well, you're going to send me the 632H, and that is called the presumptive eligibility application. And you're going to send me the release date directly to my email address. So you can just say, you know, this individual is showing active on inmate Medicaids, and I approve them. can you follow up, or just something like that. And so what I would do is to go in and verify to make sure that they have been released. And if I'm able to verify that information, then I will go into Gammons and manually add that presumptive, that's eligibility to the system, and then reach out to the member to let them know that. And then you still send your PE packet as normal to this email address. And also, when you're sending anything to either myself or anybody via email, please make sure that your emails are sent securely. So if you have to set up something with your IT department, making sure that your emails are secure, because we're dealing with, PHI information and PII information. We want to make sure that that is staying protected. So please make sure all of the emails that you send us are sent securely. So remember that list, that the A category list on slide 25, if they have any type of information that they need to report the defects, they need to either go online and do it or call the 1877 number. Alrighty, so now we're going to get into the applications and the forms and everything you're going to need. But before we do that, let's go ahead and take a 10-minute break, and we're going to come back at 10:43. Okay?
Okay, thank you.
Thank
Okay.
you. And you can leave everything up, so just come back at 10:43.
Okay.
Okay, it's 10:43. We're going to go ahead and get back started. Before we do that, I'm going to just kind of review to make sure you all understood everything that we said so far. So my first question is going to go to Wayne County for Jeremy Ross. If you have an individual that comes in and apply, and when you screen the individual, it shows that, I'm sorry, Irma, can you put your mic on mute, please? Thank you. If it shows that she's active on women's health, and let's say she's pregnant, in the system, it shows you that she's active on women's health. What would you do? Again, this is for Jeremy Ross with Wayne Memorial. And if he's not here, please let me know. Okay, do I have anybody from Wayne Memorial available to answer that question? If you don't have access to a mic, then please put your answer in the chat. And again, the question is, if an individual is pregnant and it shows she's active on women's health, what would you do? Okay, can I get, let's go to Irma. Can you answer that question, please? If a person is pregnant and the system shows that she's active on women's health, what would you do?
I will complete a PE app
Okay.
and
Does any,
add PE to GAMIS, complete the PE manual update form, and send it to DCH.
and what is the reason why you're going to be sending the PMA update form?
Mm, Let me see.
If you have to, go back to the slide where it says active on medical assistance and see if it says something different about the women's health procedure.
Let me see.
Can anybody else help her out? If they're pregnant and active on women's health, what would you do?
Hi, this is Lakeisha.
Okay,
Should report her pregnancy to her caseworker or
that
go?
is correct. Remember on that slide, I'm not sure exactly what number it is. It says active on medical assistance, the very first one. If they are active on women's health medical assistance, they need to report their pregnancy either to their caseworker or they can do it online, or either you all can send an email to the women's health email address. Thank you, Lakeisha. Slide 22. So go back to slide 22, and that's the very first one that says active on women's health. Those are procedures that you need to follow. So with these individuals, women's health, it's considered full Medicaid. So they are not, you're not going to complete a P application on them. You're going to tell them they need to report their pregnancy or any other changes to DFACS or either their casework. Um, you understand that, Irma, and everybody else?
Yes, ma'am.
Okay,
Yes.
thank you. Next question. Um, do I have, is it Takiria Booker online? Okay, Takiria. If a person is active on P4HB 181, can that person apply for presumptive? If you go into the system and you see that they're active on P4HB 181, can they apply for presumptive? Yes or no? And okay, she said yes, that is correct. They can apply for presumptive if they're active on P4HB 181. Rhonda, if a person is approved for presumptive on August 1st, 2022, what would be their PE period? If they were approved on August 1st, 2022, what would be their PE period?
The PE period would be August 1st, 2022 until August. Does that go to the 31st or 30th? Um, August 31st, 2022.
You said August 1st, 2022 through August 31st, 2022? That's what you said, right?
Yes.
Okay. Okay, she said August 1st, 2022 through August 31st, 2022. Is she correct? If not, can somebody tell me what is the PE period?
August 1st, 2022 to September 30th, 2022.
Correct. Remember, go back to the slide that I gave you those examples on. It's always the next month at the end of the month. So if they applied on August 26, 2022, the PE period is going to be August 26, 2022 through September 30th, 2022. Another one, if somebody applied on, let's say, July 2nd and was approved, PE period is July 2nd, 2022 through August 31st, 2022. So it's always the next month at the end of the month.
Okay, noted. Thank you.
You're welcome. I'm sorry, Irma, I can't understand you.
No, I was just agreeing. I was thinking, like, for example, 1/6 to 2/6, but you said the next month all the way to the end of the month. So I
Right.
got it now.
So 1/6 would be 1/6, 2022 through 2/28, 2022.
Got it. Okay.
Okay, last question is going back to Wayne County. I mean, Wayne Memorial. I'm sorry, why am I saying Wayne County? Wayne Memorial. Can you all please name the aid categories for presumptive? Again, can you all please name the aid categories for presumptive?
Yes.
Okay, I'm gonna give them a minute because they're gonna have to type it. So y'all, let's give them a minute. Sorry, you all, but we're still waiting on Wayne to type it out. Okay, so the question was, name the A categories. Okay, you have parent caretaker with children under the age of 19. That's one. You have the children under 19. That's another one. You have the pregnant woman. That's another one. And your former foster care. So those are the 4A categories. Your parent caretaker with children under the age of 19, children under the age of 19, pregnant woman, and your former foster care. Thank you all for participating. So I think you all got the gist of it, but please make sure, because on your assessment, please make sure you understand the PE period. Remember, it goes from the date that they get approved to the end of that next month, at the end of the month. So now we're going to get into the application and all the required forms that you're going to complete when someone wants to apply for presumptive. So we have your PE application or your HPE application, which is the 632H. I gave you the form number, the form name, and the date that it was last revised. So you need to make sure you are familiarizing yourself with the number, the name, and then making sure that you're using the most recent version, and the revision date is right here. And all this information is listed on each each form. So we're going to look at the HPE application. We're going to look at the notice. So once someone has been approved or denied, you will have to provide them with that notice, and it's called notice of action, which is your 634H. The next one is the HIPAA notice, which is the 5460. You have your full Medicaid application. This is called the full Medicaid application. The single streamline medical assistance application, which is your 94A. So remember, I told you earlier, for active on other medical assistance, remember the QI1 population. If they're active on QI1, you will only have them complete the 94A. So this is the form that I'm talking about. So they wouldn't complete the 632H, what people would normally complete if they apply for presumptive. They will only complete the 94A, which you're going to email to us. The 94A, and there are a couple of revision dates out there. The one I sent you is dated 9/2017, so that's the farthest you can go back. But if you have, if your office or your hospital has forms that they order from DFACS, then they may have another version dated for January of 2022 of this year. So if you have that, that's fine. But the latest one that you can use, or the one that you can use going backward, is 9/2017, which you did receive from me. So 9/2017 or later are the versions that you can use. Then you have your DMA 285, your third party liability. So if they have other health insurance, this is the form you would need to complete. Notice of ADA section 504. This is not really a form. It's just information only. Then we're going to look at the PE manual update form. And then we're going to also look at attachment A. So because we are still like in a public health emergency due to COVID, we are allowing you all to make or take applications over the phone. So the person does not necessarily have to be in the office with you. They can apply over the phone. And if they apply over the phone, you will be signing on their behalf. So that what attachment A is going to serve as, and we'll look at that. So the first form is your 632H, your HPE application. So when a person is applying for presumptive, this is the application that you're going to always use, the HPE application. Now up here, it tells you it's the hospital presumptive eligibility medical assistance. This is the application. Down here, you can't see it, but down here in the left lower hand corner, it's the form number and the last revision date. So it's 632H8/30/21. Again, This is your HPE application, so you need to make sure you're completing this for the people that are applying for presumptive. This form, you can't type on it because it is in PDF fillable. So if you're able to type out your information, I highly recommend you to do that. But if you're not able to and you have to handwrite it, please make sure that you are writing clearly, because this is one form that will be audited if you are selected to be audited, that particular one. And I'm going to have to be able to read your handwriting. So, and I know sometimes we get in a rush. We're doing multiple things and we get in a rush, and sometimes our handwriting is not that clear. So if you have to handwrite it, please make sure you're clearly writing it out. And we'll go over each of these fields in just a moment. And then there's a second page. So the second page would not normally be used all of the time. The only time you need to use page 2 is if, for instance, if somebody had 7 people in their budget group, that means all 7 people need to be listed on the application, whether they are applying for presumptive or not. Just because they're not applying for presumptive does not mean that they should not be listed on the application. Yes, we're capturing the information about the person that really wants to apply, but we also have to capture their budget group, everybody that's supposed to be in their budget group. So if you have 7 people that are supposed to be in the budget group, all 7 people should be listed on this application. So on the first page, you could only list 1, 2, 3, 4 people on first page. So you will list 4 people on page 1, and then you will complete page 2 and list the remaining 3 people. You're not going to list all 7 people because you've already listed 4 on the first page. So page 2 should only be listed for the remaining people that cannot fit on page 1. Any questions over the HPE application? Second form is your 634H, your notice of action. Whether they got approved or they denied, you are going to have to provide them with one of these forms. And this form has to be provided for each individual person that was approved or denied. So if they were approved, you're going to give them this one that is listed or that is shown here on the left-hand side. You're going to fill out the information, the date, their name, address, all of that information, and then their ID number that is coming from GAMIS. And then your information goes down here, your signature, your hospital's address, your title, your phone number, and then your qualified hospital provider ID number. If they were denied, again, their contact information or their demographic information goes up here along with the date. Instead of putting their ID number, you're going to have to choose the reason why they were denied. So that is what that drop down box right here is. There are 7 reasons why someone can be denied, and we're going to go over those 7 reasons later on. And then your information down here at the bottom. Again, this is your 634H notice of action, either the approval notice or the denial notice. Your next one is your HIPAA. So here is just telling them about how we're protecting their information. The only thing they need to do is to sign, date it, and print their name. Now this form has like multiple pages, depending on if you're using an English version or a Spanish version. So if you're using the English version, you're going to provide them with pages 1 through 5. I think it is. It may have changed because I know this has changed. So you're going to provide them all the pages except for the signature page on both versions. So the only page of this form that you need to keep is the signature page. All the other forms should be given to your applicant, and only one HIPAA form per family. So if they have multiple people that they're applying for in one family, you just give them one HIPAA form. So again, you only keep the signature page. Next one, this is the 94A. So if they're applying for full Medicaid, remember if they got approved for presumptive for pregnant women, they are required to complete this form. If they get approved for any other aid category, you're going to ask them if they would like to apply. So the first you're seeing here is just the The cover page of the 94A. The 94A is multiple pages depending on what version you have. It can be either 8 pages or either 12 pages or something like that, but it's multiple pages. So I'm just showing you just the cover page. So that is the cover page of the 94A. Associated with the 94A, there are 3 different attachments that an individual, if it applies to them, they will need to complete. So the first one is your attachment A. So if they have other health insurance and it is common, it is from their job, meaning that they're paying for health insurance through their job, then they need to complete attachment A. If they are an American Indian or Alaskan Native, they need to complete attachment B. If they need to appoint someone as their authorized representative, meaning that person will act on their behalf, and DFAS can talk to them about their case, they can receive notices and all of that. So if they're trying to appoint someone as their authorized representative, attachment C would need to be completed. And if someone is assisting them in helping them to fill out this application, which you all may be doing, you're going to have to fill out the bottom part of attachment C. So again, this is the 94A and then your associated attachments. So if the attachments does not apply to them, then they should not be filled out and should not be included in your PE packet. So only fill it out if it applies to the individual. Okay, I have one question. What if they speak another language other than English or Spanish? For presumptive, we only have it in English or Spanish. And I think all of our forms for DFACs are only in English or Spanish. So if they speak another language, you're probably going to have to use the language line. And so you just have to reach out to me. If you have somebody else that speaks another language, reach out to me, and then I will have to connect you with the language line so we can get the paperwork filled out correctly. Okay, the next one is your DMA 285. So again, if they have other health insurance, whether it's through a job or not, DMA 285 should be completed. If it's through a job, then they're going to have the DMA 285 and the attachment A if they are applying for full Medicaid. But the DMA 285 has to be completed regardless of how the health insurance is being paid. So if they have other health insurance that they're paying for, however they're paying for it, the DMA 285 form should be completed. And also, if they have available, you could just ask them, they're not required, but if they have a copy of their health insurance available, please make a copy of it, the front and back side, and send it along with the DMA 285. If they don't have it with them at that time, that's fine. Don't hold the application waiting on them to send you a copy of their insurance card back. Don't do that. If they have it with you, have it with them at that time, make a copy and send it as part of their PE packet. Next one is the notice of ADA Section 504 rights. Remember, I told you this is just information only. It's not anything that they have to sign. The only thing you need to do, a copy should be given to each household, just one person in the household, and then a copy should be included in your PE packet. Again, there are other later versions of this form out there. As long as you're using the one dated 12/9/2020 or later, I'm perfectly fine with that. Once we have all of our forms updated, because we're going through a whole lot of changes. So once we have our forms finalized and updated for the last time, then I will make sure everybody has the most recent versions of everything that we have out there. Right now, it's just a lot going on, and we have so many different versions out there. So that's what I'm telling you. As of right now, you can use this version or something that's later. So you may have one that's dated, again, January 2022. And I think we have one out there that's dated 5/2022. So as long as you have one that's dated at least You can't go backwards than 12/9/2020. So 12/9/2020 or later, I will accept. Again, this is information only, a copy given to your applicant, a copy placed in the PE packet. Any questions over those forms so far? And now we're about to get into the PE manual updates.
No.
Okay, thank you. So now we're going to talk about PE manual update form. When should you complete this form? This form that we're going to talk about, and the form is going to be located on the next slide. So these are the reasons why, or the reasons when you will complete a PE manual update form. If for some reason you don't have access to the internet, or there's something going on with GAMIS is down, you're not able to get into it, whatever the reason is, and you're not able to add the PE to GAMIS, then this is one reason why you will fill out a PE manual update form. That's one reason. Another reason is, of course, they're active on P4HB 180 or 181. That P4HB case needs to be terminated. So that's another reason you will complete the PE manual update form. Another reason, if when you're going into GAMIS, you're going to have to click or choose the A category that you approve this person for. So if you approve the person for parent caretaker, then you're going to have to choose that on a drop-down box in GAMIS when you're adding it to GAMIS. So if for some reason you mistakenly chose the wrong A category and you hit submit, because once you hit submit, you can't go back and undo any changes. So if that's the case, you put someone in the wrong A category after you hit submit, that has to be updated by us. So that's another reason why you would fill out an update form. And then if you see that there's something that you probably mistyped, or there's something already in the system that's wrong and it's kind of grayed out and you're not able to update it, because I think like their names, like their first name, their social security number, if I'm not mistaken, like their date of birth, that's information that's grayed out. You're not going to be able to update that. So if you see something like that needs to be updated, it's not right, then that's when you would fill out an update form. So again, if you're not able to add it to GAMIS for whatever reason, the P4HB needs to be terminated, the A category needs to be updated, or some of the members' information in the system is incorrect, those are the reason why, or the reasons when you would choose to do the PE manual update form. So let's look at the PE manual update form on slide 35. So this is what the form looks like. And you do have a bigger copy of that if you want to look at that. So the first thing it tells you right here, it tells you where to email this form to, and it tells you what to put in the subject line. So what you're going to do is you're going to put today's date. And the PE manual update form, I prefer you all to do this form the same day that you do the presumptive application. So that way, nothing gets held up and we're not holding on to somebody's eligibility, or if somebody's information is incorrect, 9 times out of 10, when they go to submit claims, if everything is not matching, it might not get paid. So we want to make sure everything is correct. So if you have to do a PE manual update form, please make sure you're sending it the same day you do your presumptive application. And then here it's asking you to check one of these, either pregnant woman PE, hospital PE, or women's health PE. Please highlight this right here, the middle one, hospital PE. You will always check this. Even if you have a pregnant person and you need to terminate the P4HB, or we need to terminate the P4HB, you will not check pregnant woman PE, because this is for health departments. You will always check this box right here, hospital PE. So if you need to highlight this on your copy, make sure you highlight that and put a note. Please always check the middle box, or this box right here. Down here is what you're going to indicate what needs to be updated. This whole form should not be completed. Again, this whole form should not be completed unless you need us to update everything about this member, which I hardly don't think so. So only complete the fields that need to be updated. So for instance, I kind of gave you some examples. So example 1, if a member P4HB needs to be terminated, after you put the date, you check hospital PE. The only thing else you're going to do is to go down here, right here where it says terminate P4HB. You're going to check that box or put an X in that box, however you want to do it. Go down here, print your name and your telephone number, and that's it. You're not going to put the name, the address, date of birth. So you're not going to put all of that, because what you're going to do is right here where it says hospital PE, right up under it says attach form 632H. So that means when you send this form to us, you should also be sending the 632H, which is your PE application. So from the PE application, we can get all of the person's demographic information off of that. So that's why I tell you, do not complete this form in its entirety. Only check the areas that need to be updated. Example 2. When a PE needs to be added to GAMUS because for whatever reason you all are not able to add it. So if a PE needs to be added to GAMUS, you're going to indicate right here, add PE to GAMUS, check or put an X in that box. Give us the PE period time, the time frame. And then also I should have checked this box right here. Should have indicated this right here. You're going to have to give us the A category that that person is eligible for. I know it says update PEA category, but if we're adding it to GAMUS, we're going to need to know what A category that that person is eligible for. And the last example, example 3, if you input the member in the wrong A category, then we need to update that. So what you're going to do is check the box right here where it says update PEA category, put a check or X in that box, and then click on this drop down box and choose what A category this person should be on. Any questions over how to fill out this form?
No.
Okay. So again, you're only completing the section that needs to be updated, and you're going to be sending the 632H, which is your PE application. And if you do this application over the phone, that means the member would not be signing it. You're going to be signing on their behalf. So therefore, you would need to send the attachment A so we can make sure that you sign on their behalf. So this is only if you do a PE application over the phone and the update form. And you're going to send it again to this email address right here. In the subject line, you're just going to put PE manual update. Now, I do have a note down here. If any of this information needs to be updated, we have to verify that information. So if we're updating their name, their date of birth, social security number, or citizenship, you're going to have to ask them for proof of that and send it with this PE manual update form. Okay, for the PE manual updates, since you're going to be sending us your PE packet, if you have to send us a PE manual update form, do not include that form inside of that PE packet email. So in that instance, you're going to be sending 2 different emails. One email is going to be your whole PE packet, which we're going to talk about in just a moment. And then the other email is going to be the PE manual update email, which only has your 632H and the PE manual update form, and if applicable, the attachment A. So does everybody understand that if you have to do a PE manual update form and send it to us, remember you're sending that in a separate email from your whole PE packet. And the updates that we're doing is only for people that were approved for presumptive. So if you send us an update form and we go in gammas and it shows that they are active on full Medicaid, we're going to send it back to you and let you know that this was not updated and you need to refer the member to DFACS to report any changes. We don't do updates for people that are on full Medicaid. They have to be active on presumptive. Okay, so this is the attachment A. So you have an option. You can take P applications in your office or at your hospital, or you can take it over the phone. If you do an application over the phone, you need to use this attachment, and this is the attachment to the 632H. So the first page is just your cover page telling you what to do step by step. So if you follow these steps, you will be okay. The second page is some statements that you need to read out to your individual on the phone, and they have to agree to this. So once you read them these paragraphs, then you're going to read them this question: do you understand and agree to these statements? And they can say yes or no. If they say yes, check the box right here. And then you go down here, check the box to sign on behalf of. You're going to print the name of the applicant. You're going to put the date. You're going to print your name. This is your name, not the name of your hospital. This is your name. And then you're going to sign it. If you read this question and they say no, check the box that says no. And you're going to have to read the second question to them, letting them know that either you're going to cancel this because they did not agree to it, or they can, they get a second chance to agree to it. If they say yes, then you check the box yes and go down here and fill this out. If they say no, then at that point, you're just going to have to stop and deny their application because they didn't want to cooperate, because they have to agree to this in order for us to continue processing their application. Either that, or they're going to have to come in and finish up the application and actually sign everything. Any questions over attachment A?
No.
No.
Thank you. Thank you. All right. So when the individual is approved for presumptive, this is some information that you need to provide to them. The first one is a quick guide, and you did receive this in your email. This is just telling them that they've been approved and that you're sending their application to DFACS for them to approve it. If they do get approved for DFACS, then at that point, they will be enrolled in a CMO. So when they are approved for presumptive is going to be fee for service. So if you have to bill any claims, you're going to have to bill it straight to Medicaid. You're not going to be able to bill it to a CMO. They're only going to be enrolled they only will be enrolled in the CMO once DFACS has approved them for full Medicaid. And it tells them if they need to report changes, what they need to do it. The second one is a booklet. So if they don't understand how medical assistance or Medicaid works in Georgia, this is a good tool for them. And you should have these booklets already at your hospital. If not, then you can order these through Gainwell Technologies. The way you will order them is that you will go onto the GAMIS web portal. And once you get into the GAMIS web portal, you don't have to sign in. At the top, you should see a tab that says Provider Information. You're going to click on Provider Information. And then you're going to choose the option that says Forms for Providers. And then you're going to look for the DMA 292 form. Once you have located that form, you're going to click on it. It's going to open up. You're going to print that out. You're going to fill it out. And then you're going to send it back to the address that is listed on that particular form. There's no charge to it. And the only other thing is that they do not ship these booklets to a PO box. So it has to be a street address. Like I said, you all should have these booklets already, but that is how you order more. And then the last one is Planning for Healthy Babies. So Planning for Healthy Babies, like I said, is not really for Medicaid. It's just providing them with certain type of services to plan out their pregnancy to help them with family planning. So in your email, you did receive a copy of these. So it just tells them what Planning for Healthy Babies is, how they can be covered, who's eligible, and what is covered. They can get like annual physical exams. They can get contraceptives like birth control, anything of that nature, family planning consultation, um, things of that nature. Some of them give dental services. So there are certain services that they can receive, but this information just tells them, what it is, how they can be eligible, and how they can apply. So there's one for new mothers, people that, are newly just became mothers. And then there's another one just for like young women. So again, you just, providing them with that sheet that I gave you. Any questions? Okay. So now we're going to get into the eligibility requirements. Now we're going to look at what a person, how you're going to make this determination. What are you going to be looking at? And what verification are you going to need? So the first thing is the verification. What type of verification do we need? So for presumptive, you're going to be taking their statements on everything that you need as far as income, citizenship, immigration status, resident, pregnancy, all of that. You're going to be taking their statement. And remember, again, we're not here to decipher whether they're telling the truth or not. You're just here to take their application, take their statement, process it to see if they're eligible or not, if they are added to Gammons, and send the packet to us. And we will send it to DFAS if they're applying for full Medicaid. That's all it is. So again, you are accepting their statement, so do not require them to bring in any type of verification. Now, if they have verification with them and they want to provide it to you and they are applying for full Medicaid, that's totally fine. You can accept it and send it in as part of their PE packet, and we will provide it to DFACS, and hopefully that will kind of help DFACS, make a determination more quickly. We can do that. That's totally fine. You don't have to not take it. You still can take it, but you're not required to have it for a presumptive determination. Okay, remember the eligibility requirements. We're going to talk about the non-financial eligibility requirements. Remember, they have to be a U.S. citizen, national, qualified immigrant, have to be a Georgia resident, must be the appropriate age. What I mean by the appropriate age, they have to be at least between the ages of 19, between the ages of like newborn to 19, unless they have children or they're pregnant or they're they're pregnant. So if they're between the ages of 19 through 64, they don't have any children, they are not pregnant, and have not been in foster care and aged out, then they're not going to be eligible for presumptive, because Georgia did not expand Medicaid. So therefore, if they're between the age of 19 and 64, we don't have an A category to put them in, so they won't be eligible for presumptive. And then the form of foster care, remember, age out of the age of 18 or older, but have not turned 26 yet. So the first thing we're going to look at is how you're going to determine if someone is considered a qualified immigrant. So on your presumptive or your hospital presumptive application, there is a column that says U.S. citizen, U.S. national, or lawfully present immigrant, yes or no. And you're going to have to answer this for each individual person that is listed on the application. So in order to accomplish this, this is how I recommend you all to kind of ask this question when you're interviewing your applicant. You just ask them, are you a U.S. citizen or national? And they can say yes or no at that time. If they say yes, then of course you just put yes here and keep it moving. But if they say no, then you're going to have to decipher if they are considered a qualified immigrant. So if they say no, then you're going to ask them, okay, when did you come into the United States? So based off of the date that they told you they came into the United States, then you're going to follow this immigration policy to determine if they meet one of these criteria to be considered a qualified immigrant. So the first part up here, if they came into the United States before August 22nd, 1996, then they're going to have to either meet A, B, or C to be considered a qualified immigrant. A is your lawful permanent resident. They have to be an LPR or a lawful permanent resident. B, they have to be a Somali refugee, Cuban Haitian entrants, immigrants granted parole for at least 1 year, immigrants whose deportation is being withheld, battered immigrants, or victims of severe form of trafficking. D is honorably discharged U.S. veterans or active duty military personnel, or it can be them, or either they can meet it based off of their spouse or unmarried dependent children being an honorably discharged U.S. veterans or active duty military personnel. So again, if they came into the United States before this date, then they have to either meet A, B, or C. Any questions just on number 1?
Questions?
No.
Number 2, if they came into the United States on or after that August 22nd, 1996 date, then they're going to have to meet either A, B, C, or D. So A is a lawful permanent resident, but at this point, they have to have met the 5-year requirements, meaning that they have to have been in the United States for at least 5 years. B is the same as up here in the Somali refugee, Cuban Haitian entrants, immigrants granted parole for at least 1 year, immigrants deportation is being withheld, battered immigrants, or victims of severe form of trafficking. C is lawful permanent residents with 40 qualifying quarters. So if they are a lawful permanent residents with 40 qualifying quarters, and 40 qualifying quarters equals to 10 years of employment in the United States up under the Social Security system. If they have 10 years of employment up under the Social Security system, and they have not received any type of federal tested benefits, which meaning like food stamps, the welfare, which is TANF, or Medicaid, anything of that nature, as long as they have not received any of that and have at least 10 years up on the Social Security system, it doesn't have to be consecutive. As long as they have 10 years of employment under the Social Security system, then they will meet this particular criteria. It can be either them, or if they are married, it can be their spouse or their parent. And then we're going to go off of the date based on when they got married. So just because they may have been married only 2 years, but let's just say the spouse has more than 10 years of employment up under the Social Security system. We're not going to go back and count those 2 years. We're going to count from the time that they got married. And then D is the honorably discharged U.S. veterans or active duty military personnel. So again, if they came into the United States on or after August 22nd, 1996, they have to meet A, B, C, or D. Any questions over number 2?
No.
And then the last one is number 3 that just came out not too long ago, which is our COFA migrants. So COFA migrants are people that migrated from one of these 3 countries, either from the Federated States of Micronesia, the Republic of Marshall Islands, or the Republic of Palau. So if they're from one of these 3 countries, they're considered a COFA migrant, and they will be eligible, and they do not have to have been here at least 5 years. Now, we also have, and it has not been, I'll just put it out there, it has not actually been disseminated to DFACS of policy yet about, with the Afghan immigrants and then also the Ukrainians. So if you have somebody that's from Afghan or Ukrainian, reach out to me, and then I will let you know if that person would be eligible based off of the policy that we have. We're still working on that. That has not been implemented yet. But if you do get a person that says that they're from Afghan or from Ukraine, reach out to me, and we can go from there. So again, if a person is not a U.S. citizen or national, you're going to have to use this immigration policy based on when they entered the United States to see if they meet one of these criteria. If they do not, if you go through these criteria based off of the date that they entered the United States and they do not meet one of these criteria, that means they do not meet the immigration status, and therefore the application will be denied because they do not meet the citizenship immigration status. Also remember, when you're asking that question about immigration, also on the P application, there is a sworn statement that the applicant must read because they need to make sure that they understand that everything that they're telling you is correct. So they're declaring on the penalty of perjury that they are considered a U.S. citizen, national, or a lawful present immigrant. Just because you're taking their statement, they still have to declare, making sure that they understand that they're declaring that the information that they gave you is true and correct, and that they are considered a U.S. citizen, national, or a lawful present immigrant. And now we're going to get into the budget group. So we're going to talk about tax filer status because they're going to have a tax filer status relationship. And if they do, they're considered a part of the budget group, and they will be listed on that application. And then also that would determine the income limit that we're going to use to compare their income to. Now, just because they're in the household does not mean that they're going to be included in the budget group. They have to have a tax filer or non-tax filer relationship. I have one question. We should provide a translator if they are not able to understand. Yes, so that is something that you will have to provide if you have somebody that does not speak English. Then you will have to make sure that you have somebody there that can help you with the application. If not, then you can try to reach out to me. And like I said, I can try to hook you up with the language line to see if we can get this application, get the questions answered from the application. You're welcome. All right, so now we're going to talk about the budget group. So this is very important because this is like I want to say a question, but there is a section on your PE application that says tax filer household, yes or no, non-tax filer household, yes or no. That question or those boxes have to be checked. So you need to make sure that you're understanding this part. And please ask questions if you don't understand. So we're going to try to go through this chart so you can understand how you're going to determine who should be in the budget group and who should be listed on that application. So remember, I was telling you earlier, there's one specific question that you're going to ask everybody. This is everybody. You're going to ask them, do you expect to file taxes, or is somebody claiming you as a tax dependent? Based off of the answer to that question, you're just going to follow the arrows to see whether they're going to apply tax filer rules or you're going to apply non-filer or non-tax filer rules. And these are the people listed in these boxes that should be included in their budget group and on the application. So let's take it with the first one. If you ask that question and the person says, yes, I am filing taxes. So you're going to follow this arrow, the first arrow that says yes, and it's pointing to the box that says apply tax filer rules. So that means this household is going to be considered a tax filer household. And so based off of that, these are the people that should be included in the budget group. It should be the person that's filing taxes. So it's going to be that applicant because you asked them the question. They say, yes, I'm filing taxes. So that's going to be the tax filer. Everybody that person is claiming on their taxes, whether they're living with them or not. So if they're claiming somebody that's not living with them, sorry, that person has to be included. So everybody that they claim on their taxes has to be included. If the person that's filing the taxes is married and the spouse is living with them, the spouse has to be included. So it have to be filing taxes. They have to be married and living together. I'm sorry, have to be married and living together. And always, if somebody is pregnant in this budget group or household, we always count the unborn fetus or fetuses. So if they're having 2, we're going to count them as 2. If they're having 3, count it as 3. If they're having 1, we count 1. So we always include the unborn fetus or fetuses. So if you're doing an application for a pregnant woman, let's just say it's just her by herself. So when it comes and it asks you about budget group, you're not going to put 1 because we never have a budget group of 1 for a pregnant woman. It's always at least a budget group of 2. So you will put the budget group of 2, or either she's having twins, you'll put a budget group of 3. So you always count the unborn fetus or fetuses. So any questions over the tax filer household? So when you ask that question, they say, yes, I'm filing taxes. So these are the people that should be included in the budget group and listed on the application. They're going to be listed on the 632H, and they're going to be listed on the 94A if they are applying for full Medicaid. If you ask this question again and they say, no, I'm not filing taxes, no, nobody is claiming me as a tax dependent. So you're going to follow this arrow that says no, and it's pointing to this box that says apply non-filer or either non-tax filer rules. And these are the people that should be included in the budget group based off if it's an adult or a child. So if it's an adult, it's going to be the adult, him or herself, adult spouse if living together. So if the adult is married and living with the spouse is included. If they have any children under the age of 19 living with them, those children have to be included. And then the unborn fetus or fetuses. If the individual is a child, meaning under the age of 19, in Medicaid, we consider a child under the age of 19. So if it's a child, it's going to be the child's parents if living with the child. If the child has any siblings under the age of 19 living with them, those siblings have to be included. And then unborn fetus or fetuses. So again, if they say no to this question, apply non-filer rules. And it's these people right here that should be included. Any questions over non-filer? The next one, if you ask this question and they say, no, I'm not filing taxes, but somebody is claiming me as a tax dependent on their taxes. So you're going to follow this second arrow that says yes, and it's pointing to this middle box that says, does the tax dependent meet a tax exception? So now we're going to have to first see if this tax dependent meets an exception before we see if we're going to apply tax filer rules or non-tax filer rules. So you have to go through these 3 exceptions to see if any of these apply to the tax dependent. The first one is if they are claimed as a tax dependent by someone other than their spouse or parent, then they would meet that exception. So if you have somebody says that they're tax dependent and they're be claimed as a tax dependent by their aunt or their uncle, somebody like that, then they would meet this exception. If they do meet this exception, you're going to follow this arrow that says yes, and it's pointing to this box. So you're going to apply non-filer rules. If it is a child under the age of 19 that lives with both parents, and let's say one of the parents is going to claim them on their taxes because the parents are not filing jointly, they're filing separately. If one of the parents is claiming them as a tax dependent, then they meet this exception. Again, you're going to apply non-filer rules. And then the last one is a child under the age of 19 that lives with one parent, but is being claimed as a tax dependent by another parent that lives somewhere else. And that parent is considered the non-custodial parent. So that means that person meets this exception, and you're going to apply the non-father rules. If you go through these three exceptions, they do not meet one of these exceptions, you're going to follow the arrow that says no, and you're going to apply tax filer rules. And it says for the tax dependent, it's going to be the same as the budget group for the person that is claiming them. So it's going to be whoever is filing the taxes, everybody that tax filer is claiming besides them, spouse if living together, and then unborn fetus or fetuses. So they're either going to be tax filer household or non-tax filer household. Any questions over the budget group?
Oh, it's a lot of information though.
Yes, it is. It is. But you have this, so if you need to stick it somewhere in your office to kind of go through it, but you have a bigger copy of this so you can make sure you understand if you're going to apply tax filer rules or non-tax filer rules. They will come in and tell you a whole lot of stuff, but you just have to remember what you learned in here. We're not concerned about everything that they're telling us. That's good that they're telling us all of this. But you just have to go by this question and determine who should be in the budget group. Okay. So now we're going to look at income. Remember, I told you the income is going to be Magi-based income. And Magi-based income is taxable income, but there are other types of income that is not taxable that we do include, which is called Social Security benefits, tax-exempt interest, or either foreign earned income. Most of the time when you're asking about income, they're going to say they're working or they're self-employed, something like that. So most of the income that a person is going to have is going to be in the form of wages, salaries, commission, or self-employment. But of course, we do have other income that they could potentially have that we would count. When we look at their income, we also look at some deductions. So deductions kind of help lower their income before we compare it to the income limit charts. So these are the three types of income that we can allow or kind of subtract off of their gross income to determine if they're going to meet the income requirement. And always, when we're looking at income, we always look at the gross amount. The gross amount. We never look at their take-home amount. So they have to give you the gross amount. Again, you're accepting their statements. They don't have to show you this. You just have to ask, and they just have to give it to you. So whatever they tell you, that's what you have to go by. But remember to let them know about their gross amount before the take-home amount. So the three deductions that we can allow is your pre-tax deductions, 1040 deduction, and 5% FPL deduction. The first type is pre-tax deduction. This is just for your information only, just to show you what is considered a pre-tax deduction. So if you're working, remember those are deductions that are taken out of your check before taxes. So deductions that are taken out of your check before taxes, we can subtract off of it, except for like the main deductions that everybody has, which is the Social Security tax, the Medicare tax, state income tax, local income tax. We don't take that, but things that they pay for, like health insurance, vision insurance, dental insurance, life insurance, 401k, the Roth account, things of that nature are considered pre-tax deductions. So again, they don't have to show it. You can just ask. You can just say, if they're working, say, do you have any deductions taken out of your check before taxes? And you can just give them some examples so they'll know what you're actually referring to. Next deduction is 1040 deduction. Again, this is for your information only. Only deductions that are listed on this particular form, which is the IRS 1040 form, only things that are listed in this form are considered deductions for 1040 that we can subtract off of their income. So if they have health savings account deduction, if they have educator expenses, things of that nature can be deducted off of their income. One caveat to this is the alimony, because that's line 31A. If they're paying alimony out, so they're paying alimony to, their ex-spouse, then it depends on when the divorce or the separation was finalized or last modified to determine if we can consider it a deduction or not, because that changed. So we do no longer allow as a deduction if the divorce or separation was finalized or modified on or after January 1st, 2019. So anything finalized or modified on this date right here or after this date, we no longer can consider it as a deduction. So it had to happen before this date right here. So if it happened before this date, then that's fine. We can subtract it off of their income as a 1040 deduction. So pre-tax deduction and 1040 deduction, you just have to ask if they have it. If they do, go ahead and subtract it off of their income. The next type of deduction is your 5% FPL deduction. This deduction is not automatically given to everybody, okay? It's only subtracted off of their income if they are over the income limit. So let's just say, for instance, you have someone that comes in and apply, and you see that they have is 2 of them in the household. And let's just say the income is a parent and a child. Let's say their income is $500 a month. She say, my income is $500 a month. So when you look at this, if you look at it, because we're going to be looking at parent caretaker with children, aid category. So if you look at the budget group of 2 and you come over here for parent caretaker, and this is all in a monthly amount. The monthly amount is $457. So if we look at her income now, which is $500, and she doesn't have any pre-tax or 1040 deductions, when you ask her, right now she's over. So in order to see if she will possibly be eligible, then we're going to subtract the 5% deduction, and this is $77. This is nothing that you have to calculate. It's already calculated for you. So you just subtract 500 from 77, and that is 423. So now her income drops down to 423. Now you recompare the new amount, which is 423, to this 457. Now she meets the income limit. So she passes the income requirement. Let's say again, it's still a budget group of 2, and this time she tells you, I only make $300 a month, and I have no pre-tax or 1040 deductions. So in this instance, we compare 300 to this 457. 300 is below this amount. So that means she meets the income requirement, and we do not have to subtract the 5% deduction. So the 5% deduction is only subtracted if it is needed kind of to make them eligible. So meaning that their income is over the income limit. So this is your parent caretaker with children aid category. For your children under 19, it's going to go based off of the ages of the children. So if they're ages 6 through 19, you're going to use the 133% of the FPL. If they're the ages between 1 through 5, you're going to use the 149% of the FPL. And the 0 through 1, which means they are newborn, you're going to use the 205% of the FPL. And then your last column, the PGW, is pregnant women. Any questions?
Yes.
Okay.
Can you give an example of the children 6 to 19?
So let's say we'll have to write this down. So let's say you have an applicant that's coming in to apply. Let's say it's mom, dad, and then they have 2 kids. One is 12 and the other one is 4. And let's say their income, when you ask them about income, let's say their income is $3,100 a month. Okay, so I'm gonna go over that scenario again. We have two parents, mom and dad, and they have two kids. One is 12 and one is 4. Their monthly income is $3,100. There's no pre-tax deductions and they have no 1040 deductions. Okay. So if you look at the income limit chart, first thing you're going to do, how many are in the budget group? There's 4 because you got mom, dad, the 2 kids, 12 and 4. So depending on if the parents want Medicaid, you will look at the parent caretaker with children under the age of 19, A category first. But if they only want to apply for the children, then you look at the children on the age of 19, A categories. So let's just say, for instance, everybody, mom comes in, she wants to apply for everybody. So you go to a budget group of 4 right here. Then you're going to go over to parent caretaker A category. The income limit is $653. Well, if you compare $653 to the $3,100 that they're making, they're over. You can still subtract the 116 from the 3,100. So you got 3,100 minus 116, and their income is now $2,984 once you subtract the 5% deduction. So looking at that, comparing that back to the 653, that means that they're not eligible for parent caretaker. So therefore, the mom and dad will no longer be eligible. So that's when you're going to have to look at to see possibly if the children can be eligible for the next A category, which is children under 19. So you have a 12-year-old and you have a 4-year-old. And we've already subtracted the 5% deduction, so that income dropped down to $2,984. Again, budget group of 4 for the 12-year-old, the income limit is $3,076. You compare that to the $2,984, that 12-year-old is eligible. But you go over here to the 1 through 5 for that 4-year-old, the income limit is $3,446 compared to their income, which is $2,984. The 4-year-old is eligible. So in this instance, I know she was applying for everybody, but they were not eligible for parent caretaker. So in this instance, the children only going to be eligible for presumptive up under children under 19.
Okay, thank you.
You're welcome. And we're going to go over some examples toward the end. Any questions? And remember, all of this is in a monthly amount. So we go by a monthly amount. Okay, so if you ask about income or if you ask about deductions, and when they give you the amount, if the amount is not in a monthly amount, then you're going to have to use what we call the conversion factor to convert it over to a monthly amount based on how often they get that income or how often they are paying those deductions. So for instance, if somebody is paid weekly or either they're paying deductions weekly, you're going to take the weekly amount and multiply it by 4.3333. So if you have somebody that's making $300 a week in your calculator, you're going to put 300 times 4.3333. And everybody can do that if you have a calculator. 300 times 4.3333. And you should get 1299.99. That's going to be their monthly income amount. $1,299.99. You're not going to round it. You're going to keep it whatever the calculator gives you. That's what you're going to keep it as. That's going to be their income. It's not going to be $1,300. It's going to be $1,299.99. If the person is paid bi-weekly, meaning every 2 weeks, not twice a month, every 2 weeks, because a couple of months they may get a third check. So it's every 2 weeks. So if a person is paid bi-weekly, is times 2.1666. So again, let's take 300 times 2.1666. And the monthly amount is going to be $649.98. It's not going to be $649.99, and it's not going to be $650. It's going to be $649.98. And when you're doing these in your calculator, please make sure you always clear out your calculator first. And also, if you have a calculator that automatically rounds up, you might need to get a different type of calculator, or either go into your settings and adjust your settings so it doesn't round. Because that is another area where people make a lot of mistakes on because they are rounding the income or the deductions. If an individual is paid only twice a month, then you just multiply it by 2. If they give you their annual or yearly amount, you just divide it by 12 to come up with the monthly amount. So if they're paid every week, or deductions or taken out of their check every week, is times 4.3333. Bi-weekly is times 2.1666. Semi-monthly is times 2, and yearly is divided by 12. Okay, can I get Ms. Wilkerson to read number 1, please?
An applicant works and earns $163 every 2 weeks. What is the monthly income?
Okay, I'm going to give everybody a couple of seconds to go ahead and work that out. And you can put your answer in the chat. Let me know if it's A, B, C, or D. Let me know if it's A, B, C, or D. Okay. So let's see. Do I have I have A, I have C, I have B, and I have D. See what the answer is. The answer should be D. So you should have came out to, it should have came out to be 353.15. I know the calculator probably gave you 353.1558, but you take the 2 numbers right directly after the decimal. So it's 353.15. So in your calculator, you have to do 163 times 2.1666, because that's the conversion factor for every 2 weeks. Any questions over number 1? Okay, Ms. Murray, can you read number 2, please?
An applicant receives workers' compensation benefits of $230 every week. What is the monthly income?
So you have an applicant that is receiving workers' compensation of $230 every week. Everybody, I'm going to give you a couple of seconds to work that out and put your answer in the chat. A, B, C, or D. Okay, I'm seeing B. That's C. That is correct. 996.65. Good job. And number 3, can I get Lakeisha? Can you read number 3, please?
An applicant pays $30 for dental insurance and $10 for life insurance weekly. What is the total monthly amount for the pre-tax deduction?
So let me give you a little hint on this. So you got two types of pre-tax deduction. Before you add them together, what I need you to do is to separate them out first. So that means you need to convert the dental insurance first, convert the life insurance, and then you add it together to get the correct total amounts. So go ahead and do that and let me know in the chat, A, B, C, or D. Okay. I've only had two people so far, three. Okay. Okay, everybody look like they have A. The answer is A, 173.32. Any questions over the conversion factors? How to convert if it's weekly, bi-weekly, semi-monthly, or yearly, annually? So again, if somebody's paid weekly, you're not going to multiply it by 4 times 4. You're going to say times 4.3333. And the conversion factor is listed on your income limit chart if you forget about it. Okay, now we're going to talk about income that is not always the same when someone receives it or when they get paid. So that's what we call fluctuating income. So to come up with the possible amount to compare to the income limit, then you're going to have to follow these steps to determine what their income is. So let's say, for instance, we had an individual that was paid these three amounts, $115, $112, and $90. So what you're going to do first is to add those three pays up to get the sum of all those pays. So for this, the sum is 317. You're just adding it together. The next thing you need to do is to get an average of what they pay would normally be once they get paid all the time. So you just take the sum amount and divide it by the number of pays that they gave you or the number of pays they received. So for this example, it's 317 divided by 3 because we got 3 pays. So you divide 317 by 3 and your average pay should be 105.66. Okay. So now we're ready to take that average pay and convert it to a monthly amount. So based on how often they're paid, you're going to take that average pay and multiply it by the applicable conversion factor. So if it's every week, it says multiply by 4.3333, biweekly times 2.1666, semi-monthly times 2, and if that's the monthly amount, times 1. So again, add all the pays up together, divide by the number of pays, and then convert it to a monthly amount based on how often they're paid. Any questions over fluctuating income?
No.
All righty, so let's go through some examples. Ms. Dyke, Irma, can you read number 1, please?
Yes. An applicant works and is paid semi-monthly. Applicant was paid $493 and $499 What is the monthly income?
Okay, so follow those steps of the previous slide that we just went over to see what your monthly amount comes out to be. I will give you a few seconds and you can put your answer in the chat again, A, B, C, or D. Okay, so it seems like I'm seeing C in the chat. Let's see. 992. So let's do this together. So I want everybody to clear their calculator out. So we're going to do this step by step. So you have 493 plus 499. When you add those two together, do you get 992? Yes or no?
But it said semi-monthly, so we
We're
did it.
going step, hold on, we're going step by step first. This is the first step.
Yes.
When you add both pays together, do you get 992? Yes or no?
Yes.
Now let's divide that by 2. Because it gave you 2 pays. Divide that by 2, and what do you get?
496.
496. They're paid semi-monthly. What is the conversion factor for semi-monthly times what?
Times
It's times
105.66 times 2. Oh,
times
Lord,
2.
I don't know.
2.16666.
Times 2.
Semi-monthly, semi-monthly, not bi-weekly, semi-monthly.
Oh, so it says one.
By 2.
Oh, I see it.
Times 2, and you still get 992. So that's the
992.
answer.
992. Yeah, I got that from the beginning, but I'm just
So remember, add the pays up together, divide by the number of pays, and then convert to a monthly amount based on how often they're paid, either weekly, bi-weekly, semi-monthly, and that will give you your monthly amount.
Yep, you're right.
No problem. Sorry, I got to call on the same people, but this is what we have. Rhonda, can you read number 2, please?
Yes. An applicant works and paid, I'm sorry, an applicant works and paid monthly. Applicant was paid 1,225 and 1,322. What is the monthly income?
Okay, go ahead and do that and let me know what your answer is in the chat. I'm supposed to have the word is in there. I'll update that. 57. Hey, making sure y'all follow the same steps on slide 56. You have to pull that out, Go by slide 56 and go step by step.
Kanita,
Yes.
I'm having to use my chat on my phone, so I don't know if you guys can see it.
Yeah, your answer is here.
Okay.
Okay, let's see. Answer is D. Does anybody need me to go over that one? Okay.
I forgot a step at first, and then I had to go back and was like, okay, wait.
Okay. Okay, I'll read the last one. An applicant works and is paid weekly. They are paid 500, 570, 585, and 600. What is the monthly amount? I'll give you a few seconds to do that one. Put your answer in the chat, A, B, C, or D. Okay. Have everybody mostly saying B. Let's see. That is correct. $2,442.89. Good job. There any questions over conversion factors or fluctuating income? This is a big part of your assessment that you're going to have to do this, so you have to make sure you understand it. And also, this is a big part if somebody has income and they don't give it to you in a monthly amount, you're going to have to make sure that you're using the correct conversion factors to convert it over to a monthly amount. All right, so there are certain types of income that is not included that we count. And some of the income, this is not an all-inclusive list, but this is the most familiarized type of income that someone could be receiving that we don't count. And that's like SSI income, veterans benefits, child support, TANF, things of that nature. So if they have one of these types of income, then when you ask about that on your presumptive application on your 632H, you're not going to list this income, because if you put it on the application, you're going to want to count it when it should be not counted. So if they have one of these types of income, when you ask about income, do not include it on the 632H. However, if they are applying for full Medicaid, which is the 94A, and they have one of these types of income, please tell them to disclose that or to enter that on the 94A, okay? So you all won't put it on the 632H, but they will need to enter it on the 94A or disclose it on that application. If you need a list of types of income that we do not include, we have a hospital presumptive eligibility policy manuals for all providers. So, and this is located on the GAMIS web portal. This provider manual is updated every quarter. So if for some reason you forget something that I said and you're not sure how to do it, you can go back and reference to this manual. It's very extensive and very comprehensive. So it goes through everything that I'm teaching you today and in very more in depth. I'll say that. So if you go to the GAMIS web portal again, once you click on provider information, this time you're going to click on provider manuals, and then you're going to look for the manual for hospital presumptive eligibility. Once you click on that manual, go to Appendix I in that manual, and you will see a whole list of income types, and it will tell you whether that income is included or excluded. It will say I or either E, and that's for included or excluded. And I think Appendix I may be like 37 pages. So there are multiples types of incomes listed. So if you're not familiarized if that type of income is included or not, go through that list and it'll tell you whether it's included or excluded. Another thing that I do want to say, when you're looking at that chart to determine whether it's included or excluded, beside the letter I or either beside the letter E, in parentheses, you may see something that says Magi, M-A-G-I, or either non-Magi, non-M-A-G-I. The one you should be focused on is the one in parentheses that says Magi. So if you see it says non-Magi, that does not pertain to presumptive. That's ABD. So if it's in parentheses, it has to be in parentheses as Magi. If it doesn't have anything beside it in parentheses, that means it's for Magi and non-Magi. So you can, say, okay, that's included or that's excluded. But if it has parentheses beside it, look for the one that says Magi. Any questions? Oh, one thing I want to say. So when you're asking someone about income, if they say, yes, I receive Social Security, you're going to have to ask a little bit more probing questions because Social Security has different types of income that a person can be eligible for and receive. So some of the income is included, some of the income is excluded. One type of income that a person can receive from Social Security is, of course, SSI income. That's disability income. Anybody that is disabled, they can receive SSI income. So that type of income is excluded. And with SSI income, everybody usually receives the same amount unless they are paying back an overpayment. But the federal law, it has a limit for everybody. It sets the limit for everybody each year. So I would have to research. I don't forget what this year is. I think it's like 840 or 806. I'll look it up after lunch and let you all know. But there's a set amount for each individual or either a couple that can receive SSI. If they're receiving SSI and they give you this amount, you should know that's SSI. If they give you something that is more than that amount or less than that amount, 9 times out of 10 is going to be another type of Social Security benefit, and that is going to be included. For instance, retirement survivors disability income. That's another type of income that Social Security can give to a person. So that type of income would be included for an adult. It depends on the dependent or child, and we'll go over that in just a minute. But if it's like a parent or adult, they're receiving RSDI, that income would be counted. If the child or the tax dependent is receiving RSDI and they have no other income and they live with their parent, then yes, it would be excluded also. The only time the RSDI will be included for that child or tax dependent is if they're over the IRS tax filing threshold or the child does not reside with the parent and is not claimed as a tax dependent by his or her parent. So in order for it to be excluded for the child, they have to have no other income and living with their parent. Otherwise, it will be included. Okay, so this is a good stopping point right here to take off for lunch. When we come back, we are going to go over the responsibility. So we're going to look at how you do it from the interview all the way down to you put it into GAMIS. We're going to go through how to fill out the PE, the hospital presumptive eligibility application, looking at each field. We're going to go over a few examples where I'm going to give you a scenario. We're going to go through what you would do step by step. We're going to fill out the presumptive application and also fill out the PE manual update form and also attachment A. And then we're going to look at the performance standards and look at some screenshots of how to enter this information in GAMIS if you determine somebody eligible for this program. So that's what's left over after lunch. So you want to, you can log off and come back in, or either you can keep your screen up. Doesn't matter if you you're calling in over the phone, I probably would suggest that you hang up and just call back in if you have to call back in. So we're going to break off for lunch. It's 12:22. You're going to get a little extra 8 minutes. So I want everybody back and be ready to start directly at 1 o'clock. If you have any questions, I will stay on for a few moments to answer any questions, okay? So everybody come back at 1 o'clock. And I'm going to stop the recording and I'll start it back once we come back.
Okay, thank you.